Hi, please find all the components in your Better Blood PRP Plus component kit. Our first step is to prep our blood collection tubes. Pull each plunger down until you hear a click sound. Then snap the plunger off as shown in the video. You will do this to all of the blood collection tubes. Now, let's draw the patient's blood. We like to use a piece of medical tape to hold the butterfly needle in place. Please note how she is connecting the adapter on and off the blood collection tube. These blood collection tubes automatically fill on their own. Once full, you will see that the blood stops flowing in the tube. For reference, it stops filling at the top of the sticker on the blood collection tube. Be sure to fill each blood collection tube completely full or it will throw off the centrifuge. Once the tube is full of blood, disconnect and invert the tube back and forth, mixing the heparin beads at least 3 to 4 times. We will place our blood collection tubes in the centrifuge at 3,500 RPM for 8 minutes and press start. Once the centrifuge is done spinning, we will grab out the blood collection tubes and place in a working area. Be sure to always keep your blood collection tubes upright. You will now grab your red cap in your kit to release the pressure from the blood collection tubes. See how she is taking each blood collection tube and placing it on the end of the red cap? Until she hears a click or feels the red cap break the seal, that's when she knows the blood collection tube has been depressurized. Now grab your 20 ml syringe in your kit with the transfer device attached. You will connect the blood collection tube and begin to draw out the platelet-poor plasma into the syringe. You will stop drawing when you see the heparin beads disappear at the top of the green on the blood collection tube. Be sure to not get any blood. Once you are finished drawing all of the platelet-poor plasma, you now have your finished product. This process is used by Buckeye Physical Medicine and Rehab.